it's Mrs. B. We're just going to do a quick video and review on taking and recording your radial pulse. What is a pulse? What's it mean? What is it that you are actually feeling? Okay, your pulse is your heart rate, or how many times per minute your heart actually beats. It's important to check it for a full minute because it can vary, okay? It can get faster, it can get slower, it can skip beats. You want to have at least 1 minute to be able to feel and assess and listen for exactly what's going on with the regularity, the strength of your pulse over the 1 minute period of time. The blood is actually pumped through your arteries by your heart, and your pulses vary from person to person. Over here it talks of healthy heart rates. Newborn babies 120 to 160, a baby 1 month to 12 months 80 to 140, a toddler 1 to 2 years would be 80 to 130, young child 2 to 6 75 to 120, child 7 to 12 75 to 110, and adult 18 years plus range of 60 to 100. Adult athletes can go from 40 to 60. The more fit you are, the more you exercise on a regular basis, it actually makes your heart pump more effectively and it slows down your heart rate. Now, your pulse is lower when you are resting, and it increases with activity to meet the rising need for oxygen-rich blood by your body. If you're not totally physically fit, what can happen is when you exert yourself, your heart will be pumping harder. If you have high blood pressure, your heart will also be pumping harder. If you have fluid retention, kidney issues, or if you've had a history of, say, a myocardial infarction or a heart attack, as it's more commonly known, you will have changes in your pulse rate as well. Now, your pulses in your body, these vary throughout your body. It doesn't mention anything over here because there's carotid and then you have temporal pulses as well in the forehead, but this mentions various pulse points to check your circulation. Your brachial, as you know, that is what we were checking to monitor the blood pressure, and the most common place to check a pulse is going to be the radial artery. Now, please make sure that you remember that you are checking it towards the thumb on either one of your arms, okay? It's the side that is closest to your thumb. So this lesson is going to be using the radial pulse. But going down here, you know there's one in the femoral region. Popliteal is behind the knee. Posterior tibial is on the inside or the medial side of your ankle. And dorsalis pedis is up the top of the foot. The equipment that you will need, obviously, is going to be a watch with a real moving second hand, a pen and a recording sheet, and your patient or your partner in lab. So going over the steps, okay, this picture that I inserted is actually just showing how the heart pumps and that you're actually counting the beats per minute. The pulse is the heartbeats per minute. So going over the steps to take your pulse, remember to wash your hands prior to entering the room, knock on the door, identify yourself to your patient, identify the patient, explain the procedure, tell them what you're going to be doing, provide privacy, place your fingertips on the thumb side of the wrist, locate the pulse, use gentle pressure, do not use your thumb. Your thumb actually has a pulse. Your middle finger, please be careful as well, because sometimes you can actually be feeling your own pulse rate in your middle finger. Ensure that the patient's comfortable and using the second hand on your watch, count the number of beats for 1 entire minute, and then make sure that the patient is comfortable afterwards. Wash your hands, and then at that time you would be recording the pulse rate, the date, the time, and the method used. You would say radial in this example on the data sheet in beats per minute, and if there's any abnormalities to the nurse that you would need to report, make sure that you do that pretty quickly, okay? The video over here is actually how to take the pulse. This is more of a close-up. It shows you how to palpate for the radial pulse. And again, it's over on the thumb side of either hand. You can flex or extend that wrist if you need to be able to find the pulse, to be able to get your hand steady. I often have held hands with my patient, and I have extended their wrist so that I actually can feel it, and it brings it more to the surface. Please watch this video, and then you're going to be following along, practice on yourself, and also don't forget to take the mini quiz, okay? Thank you.